Thanks everybody for joining and Happy New Year. I'm so grateful to have those of you who have registered and showing up live to another one of our free monthly wellness webinars. And if you aren't attending live, but you register, this will be available to you in a recording link. And at some other point in the near future, this also gets posted to the Dish with Dina YouTube channel. So thanks again, everybody, for being here. I much appreciate all of you. I figured meal planning is one of the most popular topics that is brought up in any of my patient and client sessions in the last 8 years that I've been doing this. And interestingly enough, whenever I'm the one creating or helping somebody create a meal plan, I would venture to guarantee and say that my statistics are correct. Close to 100% of my clients never follow my meal plan. So it's best if I teach you how to do it because it's something that has to be realistic and sustainable for you. So we'll talk a little bit about that in our conversation and our presentation today. And also, this is kind of a popular thing too, just generally speaking, with New Year's resolutions where people want to, eat healthier and start moving more. And it's hopefully something that just validates and reinforces some of the habits that you were planning on making anyway, or, maybe just uh, reminding you that you wanted to commit to these things. So let's go through here. I'll give you some of the objectives, what I'm hoping to share with you today, but also if you've attended any of these webinars in the past, some things are repeated or there might be some overview of stuff, not super in depth on some of these discussions. And then in the future webinars, I might go a little bit more in depth. So I'll explain that as we venture along in the slides. And also making sure that you have some takeaways because I always ask people to give me some feedback at the end of these webinars to make sure that I'm doing what I promised to do and that you are taking into account whatever you need to take into account as well. So some housekeeping things before we officially begin. As you probably heard when you entered into the session that we are recording this, the link will be made available, as I mentioned before, to anybody who has registered but couldn't make it live, which happens all the time. Totally fine. I'm always happy if anybody is interacting and engaging in some way. And then we also upload these in about 2 months to the YouTube channel where we have a running playlist of all of the wellness webinars that have ever been recorded and created and presented in the last 4 or 5 something years. You can use the chat box at any time because I'm kind of flying solo here. I'll stop every so many slides and I'll check the chat if any questions do come up. And I always encourage you, to just give some feedback anyway and interact and engage, or I might ask questions for you to throw things into the chat, but you are not obligated to do so. And then we do have a short section at the end of the webinar for a formal Q&A if you want to ask me literally anything. It doesn't have to be just about this webinar. So before I introduce myself, I will say that I am a registered dietitian, but I am not your registered dietitian. So please make sure that you are receiving what we are presenting in these webinars as just educational and informational. Obviously, please make sure that you're checking with your own healthcare providers before you start engaging in any new activities or habits or stop doing something like taking your medicine without your clearance from your doctor or starting physical activity. Make sure that you're checking in with your doctors, your healthcare professionals. As I mentioned, I usually say in about a couple of days, but lately it's been in about a week and a half. I will send out the recording link and I also send out an email link in the email for a survey. So we like getting feedback from you. And there's also a list or an open text box that if you have any questions or you'd like to see other topics be presented in the future, please feel free. I'm never at a loss to talk about things because lots of stuff comes up in my general environment, but also more specifically social media content and some misinformation and disinformation tends to come out too. So I'm always happy to clarify and provide to you some research-based evidence on whatever topics might be of interest to you. I also wanted to just say it is very cold right now. I'm not in my usual apartment. I'm in a different place, and this room is chilly. And the space heater behind me might go off every once in a while because it's on an energy saver loop. So you might hear that kick in. It's also very, very windy. I don't know how the internet works, but maybe it might mess with my Wi-Fi if that's a thing. I know that there's no antennas. I realize that, but I don't know. I feel like sometimes when the connectivity issues start, I always blame the weather. So just a little heads up in case we have any issues issues going forward. All right, so officially, this is me. I'm Dina D'Alessandro. I am a registered dietitian, nutritionist, interchangeable language there for the credentials. I also am an adjunct lecturer up at Lehman College in the Bronx in New York City, where I live. I've been teaching there for about maybe 7 years now, and I've also been on-campus dietitian at the Student Health Center for the last 4 or 5 years as well. I am the founder of the newly officially registered, trademarked Dish with Dina brand. So you can find me across a lot of social media platforms and on my website where I do things like this. I provide a lot of information for free. I also do some low cost and some fee-based services as well. So you can always check me out online if you are interested to work with me or check out any of the other things that I provide. And you can kind of see all the other stuff that I do there. So I won't go too deep into tooting my own horn, with the exception of at the beginning of every year, I do like to just remind people that working with a dietitian can be of value to you. I really think everybody can benefit from meeting with a dietitian. So one of the things that I tend to say, with all due respect to my healthcare provider colleagues, is utilize your specialists. You, as a primary care physician, a nurse practitioner, and an assistant, physician's assistant, you have a general knowledge of a lot of different things, but you might not have the specialized information or the credentials to be able to work with people, especially when it comes to food and nutrition, because there's so much nuance around it. There are so many things, which we'll talk about today as well, that really can harm people, harm your patients if you're not creating that conversation with that nuance and being informed about a lot of different sensitivities or cultural competence. So tap into your interdisciplinary team members like your dietitians. And for those of you who are patients, most health insurances, major health insurances, usually cover at the very least a few sessions of what's known as preventative nutrition counseling. So again, I really think this helps with if you've ever been told you are at risk for something, if you have a family history of a particular chronic condition, if you've recently gone to the doctor and you came back with lab values that seem a little wonky and you feel a little afraid, and your doctor hands you a list of foods that you should never eat again. I'm here to tell you, please don't listen to anybody. Meet with a dietitian. We can definitely help clarify a lot of that information and really provide to you a more specialized and individualized approach to alleviate any fear and confusion with managing your health. So I hope you take that into consideration and do what you will with that. All right, moving on to our conversation here. You might have heard this quote before when it comes to food and health, that good health starts in the kitchen or wherever you happen to get your food. And I will say yes, but we also like to acknowledge that it is not always the responsibility of the individual for their health outcomes. There are so many other things that are involved in keeping a person healthy or allowing them to have access to healthful, supportive things, whether it be nutritious food or affordable food or location, knowledge, education, etc. So I really like to take the onus off of the individual. A lot of the things that I share with you here, even just calling this meal planning made easy, it might not be easy for you. So take what you can out of the conversation. And if you do need support, there are resources available, probably in your city, in your state, across the country, federally funded programs where you can reach out and work with a case manager or a food pantry or a health clinic and get more support wherever you might need it, whether it's your habits, your mental health, your physical health, socioeconomic issues, etc. So please take advantage of all of that, because that is known as your social determinants of health, my friends. And if you've seen these webinars before, you know that I always acknowledge it. I never want it to sound like it's so easy just to make the right choices when some things might be stacked against you. All right, let's talk about the benefits of meal planning. Like I said, the majority of the people with whom I work always say that they need to get back on track with things and that they make a lot of impulsive decisions, or especially if they are trying to manage a chronic condition, that it's hard for them to figure out what to eat And maybe they're dealing with something like diabetes. So if you've been to some of the webinars before where we've spoken about that, then we've said things like, how often, how regularly, timing, and the way that you create portions and balance of your foods are really important in certain maintaining and managing certain conditions. So hopefully when you are establishing a plan of any sort, it does help alleviate all of the things that you see in front of you, right? Obviously, there might be some upfront sacrifice of time and energy and preparation with your budget and making adjustments accordingly. But hopefully, it takes away a lot of these kind of stressful factors that maybe do throw you off track or make you feel a little bit uncomfortable and not knowing what to do. And then also helping promote or establish and really help you get regimented and more consistent when it comes to building and maintaining those healthy habits. Um, in the course of what we're about to go through, I'll give some examples of how I utilize this as well. Like I always say, wherever you go, there you are. So meal planning isn't just when you're in your house and working a traditional job and have, the time available to you. It really can travel with you wherever you go. So whether you are a student or you're like me, you're working from home quite often, or you have an erratic schedule, or you're heading out for vacation, you can hopefully really utilize a lot of what I'm about to share with you and pick it up wherever you go. Hi, welcome. Thank you so much for joining. Happy New Year to you as well, my dear. Thank you. So, to clarify and define a little bit further too, when I talk about meal planning or meal preparation, it doesn't have to be fancy stuff. So, yes, in this particular case, I made the dressing on the right hand side. I made that salad dressing from scratch, but I didn't grow the salad leaves. I didn't go and pick a crop of strawberries. Obviously, I bought those things from a store, and you might not be able to see, but I have some chopped up little vegan chicken nuggets in that as well. So that is a processed food. That is a convenience item that I purchased in the frozen section. So you can definitely combine homemade things with semi-homemade things, with convenience things, and you can also incorporate in your plan when you do things like this as well, when you're getting takeout. I think also creating an understanding of your habits and looking and collecting data. That's really what it is, right? I'm planning to do something. Do I adhere to it? Where am I falling off track? Where am I in control? Where am I not in control? And then at the end of every week or so, you can look back and say, okay, 90% of the time I was pretty spot on, or a few things got thrown wrenches into my plans. I had interruptions. I was working late and all of my plans went out the door or out the window. And that's where you can then adjust and make accommodations going forward to be a little bit more realistic. So when you think about how meal planning is to be made easy in the language that I'm using, think about your own life. As I said before, if I'm in charge of creating it for you, I still have to get all that information from you. What are your likes, your dislikes? How busy are you? Do you know how to cook? And do you have other people in your house to help you with all this stuff? So we take all of those things into account when we do that. All right, moving forward with along those lines of setting realistic goals. So what I tend to do is take a look at who's in my vicinity and whoever is in the patient and client world, people I'm working with too. I tell them what kind of schedules are you working with? Are you taking care of little kids? Are you traveling often? Is it long hours and days and maybe you only have the weekend to really be in control? What kind of cooking skills or accommodations do you have available to you? So we're not asking you to become a 4-star French chef. You really could just boil something, toast something, rip open a bag, stick it in the microwave. That still counts as meal planning. And of course, taking into account any of your dietary preferences or modifications. If you happen to go online or look at apps or, ask ChatGPT to create a meal plan for you, you have to make sure that you're really understanding all of the nuances within that too. So maybe you don't love kale and quinoa, but we still want to make sure you're getting proper nutritional items, and maybe we can have substitutions in there, or maybe you have an allergy to something. Or I bring her up all the time, my mom, who has a lot of conflicting diseases. So she has hypertension, which is high blood pressure. She also has chronic kidney disease. Technically speaking, The food that you would think is healthy to help somebody with managing a chronic disease, in her case, the things that could help her with her blood pressure could make her kidney disease worse. So there's a lot of overlap there that we kind of have to X out. And she's on more of a limited type of list of foods that are safe and available to her, but they still meet her dietary requirements and her nutritional needs. So take things into account like that too. What are things that you're trying to cut back on or add more into your meals? If you've never seen this before, or if you've never ventured into a New York City apartment, my friends, this is my house. My apartment has, I don't know, it's like a 4x4 kitchen. I make do with what I've got here. Do you even see the refrigerator? Can you even notice where it is? Put it in the chat. Where do you think the fridge lives? Can you see it from this picture? Against the wall there, yes, we do have, cabinet space that goes from midpoint to the ceiling. Our stove is 4 burners, but they're very close to each other, so it's almost like a half size of a normal size stove. Our sink, you can see there on the right-hand corner, very small to cut, slice, dice, and wash things up. We have barely any counter space. I don't have a lot of equipment that I have available to me to put out because I just don't have the room or the real estate. It is hiding. My refrigerator is hiding. My refrigerator is located on the bottom right here, right corner on the bottom. It's under the cabinet, the countertop. So it's not necessarily as small as, say, like a college dorm refrigerator would be if you remember being in a college dorm or if you've been in a college dorm before. It's a little bit bigger than that, but not by much. And I'll actually give you the inside scoop. These are a little bit blurry because I did an Instagram story a while back where I took pictures of the inside of my kitchen and did a little tour. So I have some screenshots of this, but that's it. That's all the storage I have. And I cannot buy in bulk because I have no place to put things. We also have to accommodate our pet supplies and food and dishware and all these, containers of things. And if I have extras, I have to be really conscientious of where I put them and how quickly I use them. So those are my cabinets, what you see above the kitchen sink there. That's all 4 cabinets opened up, these 2 little areas here. That's it. This is the inside of my fridge. That's it. It's just 3 shelves, barely. I mean, we do have the door, which has like the beverages and some condiments on the door. Can you even see a freezer there, my friends? No, it's barely noticeable. It's at the very top, right above that carton of milk there in what is, I would probably say about like 2 shoeboxes worth of size. So again, I have to be really conscientious with my household real estate and the things that are afforded to me. So in my case, I might not be able to take advantage of bulk items or using coupons for extra stuff and stocking up on things. And even when it comes to leftovers, we really don't have a lot of space to make a wide variety of things and then store it away because there's just no room for it. So think about, how your inner workings are and what you can do to apply whatever you need to apply to. My background is in project management. Some of you might know that already if you've worked with me before or have heard these webinars before. So if you are not sticking it on a schedule, it is not going to happen. So whatever you're brainstorming, whatever you're jotting down, whatever ideas that you have, I really say make sure that you're putting it on something that you're looking at frequently, whether you're setting reminders, alarm clocks, you have a paper planner, a Google calendar that you use, something that you stick on your refrigerator, whatever the case may be, it has to work for you. You might need more than one day to do this. You might have to go shopping for one thing, come home, take a nap, and then maybe the next day you cut and slice and dice all the things. Or you might sacrifice a whole day's worth of stuff, or maybe you have the ability to purchase your food online and get it delivered. So this way you don't have to take the time to do that, but when it shows up, you have to then figure out what to do next. I also always say inventory what is on hand, please, because especially with food waste, if you've been to some of the webinars before, we talked about in America about almost 40 to 50% of our food gets thrown away because people just don't use it, or it's not pretty enough to be utilized in something, so it's tossed out. So inventory what you have on hand and then create from that an idea of what you might be able to make meals out of that. And we're talking about in your pantry, in your freezer, leftover things, anything that's about to expire, which we'll talk about in a second too. From there, you create a shopping list of what you need to backfill, refill, or supplement if you're going to be creating recipes for yourself that you don't have stuff for on hand. Think about the time it takes you to prepare ingredients as well. I know for me, like I said, you saw the kitchen. It's very hard for me to balance everything on my head and on my feet. So I can only do a few things at a time, and then I have to wash and prep and put things away and then go with round two. So I try to be really efficient with what I'm doing. And then obviously too, making sure you are cleaning up and labeling things that you are making for yourself and storing things away for later on. So if you've been in some of the past webinars, not only with food waste, we've also talked about food safety and how it's helpful to make sure you're writing the dates down on things and knowing when things need to are again coming close to their expiration time. Think about also variety, balance, and flexibility. So, in the left-hand side here, this is kind of like the Canadians' version of the American My Plate. If you've ever seen the food groups that are segmented out into that little graphic image of, fruits and vegetables and protein sources and grains. So ideally, if you're eating like this, yeah, it would be great if you segmented things out and you were focusing on different food groups. But you might not eat like this. You might throw everything into a blender or everything into a pot. So again, think about the different kinds of variety that you're getting. What's missing from the meals that you're making? How can you add something into it to be able to then make sure you're getting all the things that you need? And we'll talk a little bit more about that too shortly. I also sometimes like doing what I call spotlight ingredients. So say I have a couple of sweet potatoes on hand, or something is on sale or seasonally available, and I'm all excited to utilize that. Then I'll maybe use it in different ways, shapes, or forms across the week so that it's one ingredient utilized in different ways, whether I'm sauteing it or eating it raw or using it as a main dish or using it as a side dish. So again, I'm being efficient with my time. I'm trying to be cost effective, and I'm trying to reduce waste as well. As I mentioned before, with that pasta dish, think about days that you're going to be taking out or dining out. So if you are somebody who does work on site and maybe you go out to lunch with your friends or your coworkers every Friday, or maybe food is brought into your office every single day of the week during lunchtime, that's called meal planning too. You're just accounting for those things. And if you're aware of what you might be eating, or if you know what usually gets purchased for you, and you feel like, this isn't really health supportive for the things that I'm trying to prioritize, then that's where you can supplement and make sure that you're bringing things with you on your little grab and go bags, or you have an emergency stock of things at your desk, or if you have an office kitchen or cafeteria or lounge where you can store things away and put your name on them so people don't steal anything from you in the fridge, etc. As I said before too, convenience items. So you don't have to be making everything from scratch. There can be heat and eat things that you're getting from the grocery store, or maybe you're going to the salad bar or the deli station and you're purchasing some things that are already done for you, like a roasted chicken or a grilled salmon that's already done for you. And you don't have to take the time and energy to actually make that whole entire meal for yourself. And that's something that you can also include in quote unquote convenience foods. And then last but not least, life is not worth it if you can't have some fun, friends. So make sure that you are also accounting for indulgences. More often than not, even if you are managing a chronic condition, you still can have some fun. So even if you have diabetes or you have kidney disease, there are definitely things that you can eat that are enjoyable for you, whether it's a sweet or salty type of thing. You might have to make some accommodations depending on the brand name or the portion size that you're having. But this is also an area to be able to have a little bit more control as well. Like, at the end of the night, I'm going to have a fruit, but maybe on Saturday, I'm going out and we're going to have cake and ice cream and do some party things on that day. So that will be my indulgence for then. So I feel a little bit more in control leading up to that. So again, taking a look at your schedule, keeping in mind some of the suggestions here. If you attended the webinar that was called Macros and Micros and Food Groups, oh my, a few months ago, we went through all of this. So I'll give a little quick overview. And some of you who are here with me right now, you know some of this because I know that you're in some of the nutrition or the healthcare world as well. So this might be not new information for you. But we have what are known as your macronutrients. I always call this the quantity of your food. These are the things that provide you with your calories, and they're broken down into three categories of carbs and that's usually also considered your fibrous foods as well. Your protein sources, which can be animal or plant, and then your hopefully your healthy fats or your fat containing sources as well. So a wide variety of things here. If you tend to concentrate in just one area all the time, you might want to see where there's an opportunity to bring in other things, again, to have that well-roundedness for you, to give yourself not just one source of macros. So just as a real quick tip, macronutrients in the carbohydrate family are an immediate source of energy, meaning that your body utilizes them pretty quickly. So even though I have avocado listed here, avocado is also a healthy fat. So this aside, most of the stuff that's listed under here where you would see it and say, oh, those are carb dense foods. Usually in about 2 hours or so, your body's going to get hungry because it's utilized that energy for you. So when you bring in sources of protein or fat into your meal, then you create a well-rounded, balanced diet for yourself. So I tend to encourage people, take a little bit of everything from different columns. And if you're still hungry for extra rice or extra pasta or something that feels a little carby for you, then go back for seconds. But try to make sure, if you can, to meet the kind of criteria of creating that well-roundedness in your macros. And then when it comes to micronutrients, those are your vitamins and minerals, no calories here, but this is what I call the quality of your food, where all of those vibrant colors come in and you're meeting your needs for calcium and iron and vitamin D, etc. All of the stuff kind of crosses over here too. So again, if you have a wide variety, a diverse diet, odds are every day you're going to be meeting close to what your body requires of you to need. So you can see on the bottom, I put a little pro tip down there that if you are diversifying your diet, and just like I said before, like as an example with that takeout plate of pasta, okay, that's carbs, pasta, protein in the cheese, tomato sauce counts as a vegetable. Okay, fine. But I probably would throw in maybe a handful of spinach. Like I might throw that on top of just regular raw spinach and let it kind of wilt down. Or maybe I cook or saute a side dish of vegetables, or I bring in and order a side salad. Or maybe I'll do my little vegan chicken nuggets there. Or if you eat animal products, maybe you'll do, some shredded chicken or throw in some meatballs. So again, you're kind of adding in what's missing so it's not too much of a dense one only macronutrient represented. So even when you're eating out, that's something to consider. And then, yes, like I said before, prioritizing your nourishment, but also making sure you have some enjoyment factors in there too. I tend to encourage people to follow an 80-20 rule. So think about all of the things that you eat during the course of the week, whether you make them and you're in control or you're getting them from outside, takeout, dining, whatever. Ideally, about 80% of your 21 meals over the course of 7 days worth of food would be health supportive, would be something that you have some control over, would be maybe mostly whole foods or maybe minimally processed foods, but we can get into that in a different webinar as to the healthification of certain things too. And, whatever is available to you, I'm happy if you're just eating. And then maybe 20% of your meals are things that are a little bit less spot on, things that you have some flexibility with. So we're trying to just make sure that you have some improvement. You're keeping things prioritized, but you're allowing yourself for some flexibility and freedom because, again, there's no enjoyment in forcing yourself to just be healthy all the time. And we also try to be conscientious about using that word too. Just because you have some fun foods doesn't make you unhealthy. Just because you're dealing with certain chronic conditions doesn't make you unhealthy. It's how and what is set up to make sure you can manage your personal needs. All right, moving into, again, encouraging you, this is kind of cost effective in a lot of places, seasonal produce. So whether you're going to a farmer's market or you're shopping at a grocery store, checking in what's available during the season. So in New York, we have something that's called Grow NYC, and you can look that up online and they'll show you what's in season, whether it's again, at your farmer's market or just generally speaking in our East Coast area of what's available. Usually the hardier type of things like onions and leafy greens and broccoli, those are going to be available year round, or they'll be temperature stored and then brought back out on a regular basis. And then other things like berries or apples, different kinds of fruits and vegetables here that might be a little bit more specific seasonally, where they're really at their peak of freshness and flavor. If you purchase them and you have them on hand, sometimes you can slice them up and wash them and stick them in the freezer and keep them there. Again, depending on your preference and the way you may or may not love certain textures, you can reuse them in things like smoothies or in stews and not really suffer the consequences of feeling something different. But if you're going to freeze something like a strawberry and then have it defrost, it might not be very palatable for you. So it just depends on your personal preference. But again, you can optimize whatever you have, whatever's available for you in budget friendly and also in time sense as far as cost effective and also seasonally available. And you can keep them on hand for now, or you can keep them on hand for later on if you really enjoy something and want to incorporate it later. Yeah, I don't have all this stuff, and I have a culinary background, so I don't have the space in my kitchen, as you saw before, to store any of these things. You can really make do with very, very basic and minimal amounts of tools and equipment. So try not to stress out too much what you may or may not have. I mean, a lot of people love the slow cookers or the Instapots. If you have the counter space for it, that would be a great thing to do, especially if you're a busy person, especially if you like just chucking things into something, setting it up and leaving, and then coming back and your meal is made for you. But I use things like baking sheets and just one pot, one pan. We have some measuring spoons and cups, but I don't really weigh or measure things, unless there's an actual recipe. I tend to just eyeball everything and taste things as I go. Labeling system, as I said before, so some way that you can just make sure you're putting a note on whatever you are making and sticking back into storage so you know when it has to get eaten or tossed. On our end, we have glass everything. So they're heavy. They're not very easy to transport when I'm going out anywhere, but I tend to like metal and glass instead of plastic in my apartment. So, but we can write on that. So I take a Sharpie and I write on the glass container, lentil soup and whatever the date is that I made that. All right, next up, we talk about batch cooking or one pot meals. Again, thinking about time, efficiency, storage, and I'll explain a little bit too about how I define this. You can talk about batch cooking, meaning you're doing all of the cooking in one specific time block. You can also talk about it, meaning I'm using one pot or one pan and I'm making the meal that I'm going to break into different portions later and I'm freezing it or sticking it in my fridge or whatever. Or like you see on here, you can batch cook ingredients that you can keep separate and then mix and match. So on my end, and think about this too, like, maybe you get bored very easily by eating the same thing over and over, but you don't necessarily want to make 21 different meals that are all different varieties. So that might be useful for you to just batch cook and separate out a handful of spotlight ingredients that you can use in different ways. You can combine them in different ways over the course of your meals. So, maybe you have, like I have this little section here, that's string beans and some braised collard greens, I believe. So maybe that's something that I use as a side dish, or maybe I chop it up and I stick it into a casserole or a quiche or something like that. So it's, hidden in another kind of one pot, one pan meal. Here are some examples of things that I do and also some examples that I found on the internet just to give you some insight into what I'm talking about. So these are hard-boiled eggs, super easy, right? I take a dozen eggs when we buy them and I take half of them out and I boil them and then I leave the other half for raw so we can have fried eggs or a scramble during the week. But I keep these on hand to chop and slice and dice and stick into salads or make an egg salad sandwich or whatever. So again, this is also considered meal planning and batch cooking in preparation for what's to come. This again is just kind of like a stew with a bunch of different, again, you can see the protein, the fats, and the carbs all in here, and a wide variety of probably good seasons that looks very hearty. If you were at the root vegetable webinar last month, we gave a big shout out to doing sheet pan cooking, whether it's one particular ingredient or a variety of ingredients. And I think here that's chicken as well. So this could be an option too. Like I said before, you're not necessarily creating an entire recipe, but you're making a bunch of stuff that you can kind of compartmentalize and keep separate and then mix and match over the course of the meals to come. This is an example of the quiche that I made, probably some veggie quiche or whatever. Again, slice it up into little wedges and I wrapped those up and I either stuck them in the fridge or stuck them in the freezer, made a note as to the date and time when I made them, and then ate them on the way. So again, these can come to room temperature or be stuck in the microwave or put back in the oven if you like that better, to heat them up or eat at room temperature. I'm fine either way with some of this stuff. All right, when you're going shopping, so kind of bringing together a lot of the things that I've already been talking about, feel free to mix store-bought things with whole foods, with packaged ingredients. Obviously, whatever works for you, whatever's on sale, whatever is going to be included in your recipes, take that into consideration. I very much encourage you to please be a conscientious consumer and read your labels. Lots of stuff I have available to you if you want to know how to do that. I'll share a little bit more about that at the end of the webinar, especially if you have allergies or you're sensitive to something. Make sure you're not eating something that is going to cause you to have an anaphylactic shock or die. That's very important. But also, if you are trying to manage a chronic condition like high blood pressure or kidney issues or diabetes, you're checking the labels. And if the food that you're purchasing is like a heat and eat item at your grocery store, that they have the hot counter there, that they're making everything for you, obviously they might have a proprietary recipe that they're not going to divulge, but you can ask them, are there nuts in this? Is there a lot of butter? What kind of, ingredients are you using, just so you can get a sense of what's available for you and if it's safe. That's important. And then, yeah, definitely check to see if there's things on sale, seasonal availabilities, flyers, coupons, etc. But I very much encourage you, I will keep encourage you, do not overbuy. If you do not have a plan, when you're bringing home all the stuff, your 5 to 10 pound bag of potatoes, what are you doing with that stuff? Where are you putting it? How many potatoes are you really going to eat in a week? Is that going to go bad? Or oranges? I always bring up that as an example. To this day, my mother still buys a large amount of oranges, and I will always show up and throw half of them out. Unfortunately, they're very, very rotten by the time I get here. So think about that, right? This is the whole point of this also, is not just time efficiency, but budget friendliness. Don't waste your money just because something's on sale. It's not your responsibility to take in the inventory of someone's stock. Make sure you have a purpose and a place for all of that stuff to go. And then here, if it's easier for you to take a little screenshot of this, or when this is sent to you in the recording, you can jot this down. I won't read through all of the tips here that we have for you. But one of the things I do encourage you to do, a lot of people like to wash, slice, and dice all of their produce when they bring it home. And I will very much say, please don't do that. Make sure you're doing it right before you need it, because that can exacerbate some foodborne illnesses, and it can also increase the spoilage. So make sure that you're not just like wrapping up wet things and sticking them in the fridge if you haven't cooked them. So leave things as they are, and then when you're ready to utilize them, then you can wash and chop and slice and dice all that stuff. Thank you for the confirmation. Oh, how long can the hard-boiled eggs so this is a good question. There is foodsafety.gov, I believe, is the website. Can I put that in the chat? Yeah, I think it's foodsafety.gov, if somebody wants to click on that and just confirm that for me. They have a whole database that tells you when things can last. Now, listen, if you're like me, I'm a child of immigrants who suffered war-torn famine issues. They will just cut off all of the rotten parts of things and still eat them. And I'm going to say, please don't do that, because you never know how far in the bacteria has reached or the parasites have formed inside your food. So ideally, if something is wrapped tight and airtight and in, a temperature control environment, probably 3-ish days or maybe 5 days if you're pushing it. It also depends on what kind of foods. Like if you're making a smoothie where you have a lot of ingredients in it and it's cold and it sits in the fridge in a sealed container, probably by the 4th or 5th day, it starts to ferment. So there could also be kind of like a tanginess, taste change in it that is a little offensive, and then all of a sudden you're throwing that away. So I would say probably no more than 1 week for a lot of things, but usually it's more around the 3 to 5 days, I believe, for most stuff, unless you're freezing it. But double check that and make sure that you check the sell by date, the best by date, the expiration dates, and then anything that is a whole food that you are in charge of making, look it up on the food safety website. And again, down on the bottom there, make sure that you're labeling things. I can't tell you how many times I'm a culprit of this too sometimes, where I'm like, oh, I'll remember what I did. I'll just stick it in the fridge. And you saw how tiny that fridge is. How hard can it be to keep track? My friends, there have been science experiments that I've come across sometimes that are very, very uncomfortable and embarrassing to talk about. Okay, so again, kind of giving you some more ideas of getting creative. Again, whatever that means to you. If you want to experiment and have fun and you have time to play around with 1,000 ingredients on a recipe, then do so. If you feel like doing 21 meals within 7 days of meals and snacks that you know for sure you're going to eat and utilize, go ahead and do it. Me, I usually go on like a 3 to 4 day confinement and then I rotate through stuff and have leftovers. There's also something like supercook.com, a website that is a recipe generator website. I call that like the MacGyver website where you have, whatever random things on your inventory and you're like, what do I make with this? And you can look at a website like that or a smartphone app that can help you utilize whatever's on hand and give you some ideas. Thank you. Thank you, Amy. Thank you for putting that in the chat. Up to 7 days in the fridge as far as the hard-boiled eggs are concerned. So this is me. This is mine. I have a weekly meal plan. It's a blank sheet of paper, super basic. Left to right is where my dates are. On the I guess that's the, y-axis is the meals themselves. And then this is an example, and I apologize for kind of the hard to read font that I chose for this, but this is what I do every week. I scribble down all the things, and I'm not really a snacker, and I very much eat a hearty meal when I have my meals. And I've also started coming to terms with, as I'm getting older, I do the early bird special. So usually by about 4 to 6 o'clock, I'm done with all of my food. And then I start getting ready for my nighttime, my bedtime routine. So my day of eating is anywhere between like 7 in the morning to 7 o'clock at night. And sometimes these things suffice because what you're seeing on screen here just says, bagels. But when we have a bagel, we have a hearty bagel. It's got lox, cream cheese. It's got a handful of spinach, sliced tomatoes, or it's smoked whitefish, or whatever, my breakfast sandwich is going to be. The eggs and avocado, very hearty. The oatmeal is not just oatmeal. Like I said before, I have a balance. So I mix in peanut butter, or I'll do a handful of nuts, and I'll show you some pictures of some of this stuff later on in the coming slides. Or like on Saturday, date day is we went out to brunch. So I'm not eating at 7 in the morning when I'm going to have a really hearty meal, whether it's French toast or an omelet, or what are some of the things that I love eating? Like the huevos rancheros. I love those. So I know that's going to be quite hearty. So I'm not going to start my appetite early in the morning. I'll wait until I have my brunch, and then that'll probably keep me super full until later in the afternoon. And then I'll just pick in through and see what's available for leftovers. So these are actual photos that I shared on Instagram and some social media in the past. So that is what I eat. Like I eat a pretty hearty breakfast. Don't at me about the ketchup, okay? Because there's hot sauce on there too. You mind your business when it comes to condiments. This is what I'm talking about with the oatmeal. So I have a bowl of oatmeal. It's got peanut butter already in there. There's sometimes fruit in there, like berries of some sort. That's a cup of coffee on the side. I'll actually sometimes even put yogurt or like a dollop of cottage cheese. I don't mind certain textures or flavors. You might be different. This is an example of what I was saying before too, like a grilled salmon that maybe I made myself or maybe I bought it at the supermarket. And then I have a variety of different vegetables and carbs as side dishes, but I could also mix and match this too and make that a whole entire meal like this, my little leftover, empty the fridge into a bowl and whatever shows up, I eat. If you don't love your foods touching, you can do something different. Like the sweet potatoes can be on the side, or maybe you mix up the little mozzarella balls and your olives and your pasta and your mushrooms, and that can be a little pasta salad. And then you can have a protein source of something on the side. So what I always do in these webinars is I ask you now to reflect upon, and if you feel like sharing in the chat, feel free to interact and engage, because I really haven't asked any questions of you as I've been going through these slides. What are things that you're looking to start doing? What are things that you're happy about that you want to continue doing that works for you, or you want to try to be more consistent at it? And what are things that you want to stop doing? You can pick one, two, or all three of these things. And if you feel like admitting and confessing in the chat, feel free to do so. But just think about that, because then the next step would be, how do you implement that? Go back to what I was sharing before, plug it into your calendar, write things down. The next time you're at a grocery store, take a look at what's available, inventory your kitchen supplies and whatever food is available on hand and see what's going on there. So maybe the start thing is to start doing exactly this. Start making more of a consistent plan. Maybe you do 3 lunches a week and that's it for right now until you get more consistent. Or maybe you have a seasonal change where you have more time that you can do fun things for yourself. If you're like, I'm doing all this stuff, and thank you, Dina, for validating me, then keep at it. It's really good that you have control and responsibility and you are in charge of the things that you're making, and hopefully you're benefiting from that too. And if there's anything you want to stop, like I want to stop doing so much takeout, I want to stop spending so much money, I want to stop throwing away so much food, make that a commitment or a promise to yourself as well. There we go. Yeah, there we go. Thank you for chiming in. Continue meal planning, stop food shopping if you don't need the food, right? You get kind of like, ooh, let's go. This looks fun. And then you go home and you're like, I already have that. Like or I come home and I'm like, what am I supposed to do with this? I have no plan. I have no plan for that. And writing it down, writing it down. Okay, my shameless plug, one of my commitments, one of the things I'm stopping doing, maybe not for the whole 2025, but definitely for the first few months, I've deleted a lot of my social media apps. It's just so time consuming to be on all the things. I love YouTube. It's the place where it feels things can actually live and be really searchable. And it's also a library of stuff. So like I said before, if you want, there's a whole playlist of just meal planning things. Back, how many years ago was that? Before I went gray. Tons of stuff like part one, part two, how to read nutrition facts label, how to integrate some mindfulness as well. If that's something you feel like you're always rushing through meals and you're not really paying attention and being more intuitive about stuff. So feel free to check out youtube.com. I'm Dish with Dina across all of the social media networks in the land, even if I'm not actively on them. And I'm going to try to do more of these kind of, like little short snippet helpful hints more regularly every week. But there's a ton of stuff that already exists out there. So obviously, click like, subscribe, share, follow, all the fun things. And honestly, if I could just take a moment to say this too, like I really appreciate everybody who signs up and registers as I guess I would call myself a small content creator when I do these types of things. That stuff lives out there in the universe for free. So people can access things. If they can't work with me or they don't have the money to go and purchase services, I hope that I'm providing stuff that is of value. And the way that I can grow and the way that I can get messages out there to a larger audience is for you to tell people that you liked what you heard or that you thought what I provide is interesting and useful, and forwarding it on to your friends, your loved ones. If you hated it, try not to bash me online too much. Just send me a note, be like, I hated it, and I'll try my best to improve going forward. Because I'm okay with constructive criticism. I'm not okay when people yell and troll me online. But check out some of the playlists that I have on there. As I said before, working with a dietitian is very beneficial. So both in the two categories that I have, I work with students and interns. So I mentor and I help them with career coaching and business stuff. And then with my patients and clients, I work with them with nutrition counseling, et cetera, et cetera. Depending on where you live, I might not be able to work with you, or depending on the insurance you have, we might not be able to work with each other. But try to reach out to a dietitian in your network, or click on my website where you can check out my blog posts. You can learn a little bit more about a variety. I don't really specialize in anything, so I try to put a ton of different topics online so that you can learn a little bit more about everything to make you feel really confident and not confused in when you go to your own healthcare providers of what you need to ask them and what you might need to do if and when you want to hire somebody to work with. So thank you. On that note, everyone, feel free to open up the chat now if you have any questions, comments, or feedback. As I said, you can find me across everywhere as Dish with Dina, but I'm probably really going to live mostly on YouTube from this point forward and mostly on my blog posts. And then next webinar for February, we're going to talk about the science of weight, not weight loss, because that's a big thing during the new year, but more about the body composition and what weight is and how it is used in healthcare and what things affect weight too, whether it's different kinds of body changes over the course of your life cycle, or if you're dealing with different kinds of conditions, how that might affect your weight as well. So that will be Thursday, February 13th, 2025 from 12 to 1 p.m. Thank you so much. Thank you so much, Lily. It's great to see you. I appreciate everybody being here. Again, I'll hang out for another minute or so if anyone has questions, comments, or feedback. And then keep an eye out in a few days, I don't know, 3 to 5 to 7 days. I'll send the link out to this so you can rewatch it, share it with your friends, and eventually it'll be posted up to YouTube in a couple of months. Thanks, everybody.